Hi, in this video, let's talk about sore hip. Hi, welcome back. This is Elbu, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness, and performance. So if this is your first time here and you haven't subscribed or haven't hit the bell button, you can do so, because this way YouTube will notify you when I post a new video. Okay, so well, with regards to sore hip, there are a few questions excuse me, there are actually a few questions that I would want to ask you to question yourself, because usually with soreness you will realize also something is already not quite right happening on that side of the hip, and especially if you're feeling on only one side, then it's even more obvious that you're not treating your hip equally. So this is what I mean. If you have been overloading on one side of your hip, if you have been in a position where you're not getting equal balance of the hip, if you haven't been relieving it or trying to stretch it properly, these are some of the common things that I would actually ask or try to get more information from my patients, because this tells me a lot. So for example, most of the time when they step into the room, they take a seat and they complain about a hip issue while sitting in a position where it's cross-legged. This already gives me quite a good picture, because this is more like a habitual problem. This is your habit, and if you prefer to sit cross-legged this way, the muscles comparing the left and the right, it's already slightly different, and this can cause soreness of the hip. And apart from this, let's talk about postural. The other one would be overloading. Depending on the sports, depending on what you do, depending on how you function, some people tend to stand on one side more than the other, and that's very natural to them. But what they don't know is that they're actually stressing, or they're actually making use of the muscles on one side more than the other, and in this way you could also feel some form of soreness after some time. So I usually also get people to be mentally prepared, because sometimes the soreness happened like years ago, but it's not as frequent, and so they don't care about it, they didn't think too much about it and let it go. And the longer you get it fixed, the longer time you get it fixed since the onset, the longer you need to get yourself back, comparing to those who just got it instantly and then they seek help. I don't know if this is common sense for everybody, because there are many ways to get relief, and they think that they feel better. From my perspective, I always want to go to the root cause of the problem. If you're not there, and you're not helping yourself, you're always just looking for quick relief, that won't help you. And those questions, you have to answer them, and here's my answer. A lot of times there will already be imbalances, weakness, compensatory around the area, and all this, it's not going to be fixed in one day or even 1 week. It takes some time. Like I said, if the onset started like could be months, could be weeks, could be years. Some people tend to not think about it. Some people are not so bothered by it until it becomes a very big problem. Then they want to seek help. That's when they also need to realize that to set the expectation right, those actually need some time to get you to recover. Okay, so when we say overloading, when we say compensatory, when we say weakness, you have to get you have to get yourself checked by a professional. There are already some videos that I post previously that you can actually take a look and understand the hip area, what are the muscles that can give you problem, the inside, the outside, the back, the front. That will help you understand a little bit. Some videos do help you get relief, but it doesn't solve the root of the problem, because there is some form of testing and some form of assessment that's required to get this done. So once we get that, then the exercise will come in, the strengthening will come in. If not, all of them is just shooting in the blind and you don't know whether it works or not. And if we talk about imbalance, if happened that you strain this particular muscle, and if I were to get you to do a exercise to strengthen that particular muscle which you are already overloading, what do you think is going to happen? Most likely you're just going to feel more sore, and you think that whatever that I put out here, it's not useful. But that exercise is actually for whoever has got weakness for that muscle. So it doesn't apply to you, and if you don't know what's happening and you just do any exercise that you can find, well, I guess it's a 50-50 chance. I am not going to put up a video to get people to do those exercises to make things worse. So that's how I will approach. I usually recommend you to see somebody to get it fixed, because the assessment needs to happen. For you to self-assess, it's very tough. You can get more information and to understand what's happening, to make a better decision who you want to see, but it doesn't get you sorted out so instantly and so quickly. Like I said, it's 50-50. Some people may find the exercises helpful, and it can actually help them manage the soreness, the pain, which is good. Just to caution, if you haven't get to the root of the problem, this may come back, and it may come back even worse than before, because you're just managing it. You are still overloading it. You are still, the weakness is still there. The problem is not sorted out. Okay, so this goes on to another topic where we talk about biomechanics, because, well, this is how the body works. You are trying to get into a certain position, or you're trying to fulfill a certain movement. You always often see that you have no problem doing it, but you didn't manage to see how you actually do it, because once you change your angle, once you change how you are supposed to move, you're actually using a different muscle, and that's where the compensatory movement comes in. And when you don't know what you are trying to compensate, usually those muscles are not supposed to do that particular job or to fulfill that particular movement. But because of how you did it, those muscles have no choice but to come in and do those movements. Over a prolonged period of time, those muscles will get overloaded, those muscles will get strained, and you start to feel something else more than usual. That's how usually things escalate and gets worse. Usually when we talk about musculoskeletal issue, or most of the patients that I've seen, and that's quite common. So if you have a sore hip, these are some of the reasons why you can get yourself into trouble. Do look up for my previous videos. Those would help you understand better. Alright, so don't just idle sit there and do nothing. Look for more information, look for somebody who can help you better, and get the problem sorted out once and for all. Okay, so I hope this helped you when you look for a sore hip. And if you find this video helpful, don't forget to click on the like button. And if you haven't subscribed to my channel, or even hit the bell button, please do so. This way YouTube will actually notify you when I post a new video. Alright, so that's all for now. Please take care, and I will see you in my next video. Bye bye.